Hodgkin's Lymphoma by Emily Savage. What is there to tell about Hodgkin's? It's a cancerous lymphoid neoplasm that can commonly be seen inside lymph nodes. These lymph nodes may deform its structure in extremely large tumor cells that are defined as Reed-Sternberg cells. When a patient undergoes Hodgkin's, their Reed-Sternberg cells inside these lymph nodes begin to grow up to more than 40 micrometers in diameter, and the nuclei are surrounded by an unhealthy halo. Although the etiology of this disease is well unknown, science has discovered through widespread data that it is an infectious etiology, which basically infers that the study of the origin of the disease may be helped by an infectious virus called Epstein-Barr virus, or ABV. Although there are many who have this disease are found to have this past infection, not all have been infected by EBV. The gender and age of the patient may also contribute to the risk of developing adult with Hodgkin's lymphoma. But before moving on, here are some key points that help determine if someone has HD. Lymph. This is a colorless fluid that travels through the lymph system and holds onto lymphocytes. Lymphocytes. These protect the body from infections and the growth of tumors. Lymph vessels. This is a network of thinner tubes that accumulate lymph from different parts of the body and recovers it into the bloodstream. Lymph nodes. These are found to be small bean-like structures that filter lymph and store white blood cells that fight infections and diseases. They are located near the lymph vessel network throughout the body. Some clusters of lymph nodes may be found under the arm, pelvis, neck, abdomen, and groin. Spleen. This organ produces lymphocytes, filters blood, stores cells, and breaks down old blood cells. It's located on the left side of the abdomen by the stomach. Thymus. This gland allows lymphocytes to grow and multiply. It is located behind the chest and the breastbone. Tonsils. This organ obtains two small masses of lymph tissue near the back of the throat. They produce lymphocytes. Bone marrow. This is a small sponge-like tissue that is located in the center of the large bones. They produce white blood cells, red blood cells, and platelets, which help heal wounds and prevent bleeding to form clots. This is an overall view of the entire lymph system. What are the clinical features of HD? In common cases, patients with Hodgkin's will notice enlarged lymph nodes or tumors. They may also undergo weight loss, anorexia, anemia, and a high fever. Some other symptoms include fatigue, night sweats, chest pains due to coughing or breathing hard, flushing of skin, pain below the ribs, and an unexplained itching all over the body. Like other cancers, the extent of these symptoms are determined by stages that are based on a physical examination by a doctor. In typical cases, doctors may diagnose after a biopsy of suspected tissue, which is mainly a lymph node biopsy. A bone marrow biopsy may also be inspected. These are the following stages among Hodgkin's disease. Stage 1. The disease is limited to one anatomic region or two contiguous anatomic regions on the same side of the diaphragm. Stage 2. The disease is found in more than two anatomic regions or in two contiguous regions of the same side of the diaphragm. Stage 3. The disease is found on both sides of the diaphragm, but not extending beyond the involvement of the lymph nodes, spleen, or Waldeyr's ring. Stage 4. The disease is found in the organ, the lymph nodes, the spleen, and/or the Waldeyr's ring. How can this be treated? Well, before you can begin any treatment, everything is determined based on the size of the tumor, the age of the patient, as well as their medical issues, and the stage the disease is at. Usually low-graded lymphomas aren't even treated since treatments based on lymphomas aren't capable of increasing life expectancy. Patients whose diseases are on a much higher scale are treated with chemotherapy with or without radiation. Recent studies have found that most cases of Hodgkin's are potentially curable. However, those of a lower grade lymphoma have a life expectancy around 7 to 10 years. In most of these cases, the years tend to be considerably longer. Protocols are developing today for low-graded lymphomas in search to increase life expectancy. Therapies such as interferon and antibodies that are directed to kill tumor cells have been studied much more thoroughly, as they have been seen to treat cancer patients as well as chemo. However, it is still not as well known as that of chemo, since its treatments are still being experimented today, and it isn't a very popular choice. Here's an educational recap on Hodgkin's lymphoma.
Lymphoma is a type of cancer that begins in white blood cells called lymphocytes. Lymphocytes are the main part of our immune system and circulate in blood vessels, as well as in their own network of vessels and lymph nodes. From there, they can enter the blood or tissues to respond to bacteria and viruses. Lymphoma develops when lymphocytes grow and divide uncontrollably into tumors, crowding out healthy tissue and organs.
There's no certain way on how to avoid Hodgkin's, but based on scientific research and data, there are ways to keep healthy that lower your risk of becoming another HD patient. Here is a Hodgkin's survivor and his story.
Go. My name is William Jeffrey Savage. I'm Emily Savage's father. I am 49 years old, and in 1982, I was diagnosed with Hodgkin's lymphoma, type of cancer. I was a sophomore engineering student at Georgia Tech, and very active, very involved in lots of activities in fraternity and studying at Georgia Tech. It was May, and it was, turning into spring of the year. I did basketball and working out, and I noticed that the left side of my neck was starting to bulge out, as if all the working out was only affecting one side of my neck, and we thought that that was very odd. So I went to see my doctor to see if he could help explain why the left side of my neck was bulging out, and if I needed to change my workout regimen to prevent that from happening. Disbelief, because at 20 years old, you tend to think that you're immortal and nothing can happen to you. You're in the prime of your life. All of your life is before you, and it just didn't seem real. It was a surreal experience. The Hodgkin's itself, the effects were hard to notice other than the physical effects on my neck, and the treatment was really what you noticed. They found it early enough that they could treat it. Had it not been for the treatments, there's no telling what the effects could have been. The radiation makes you very tired. I lost lots of my hair. I have scars all over me, tattoos where they had to line up the radiation machines. So there's a whole host of effects that mark what had happened to me. But I would tell you that the mental effects, while difficult at the time, it's one of those experiences that you would never wish on anybody, but it's also an experience that you'd never exchange for anything, because it so fundamentally changed me. Well, once they discovered it, they took a biopsy of my neck. They immediately rushed me to the best medical hospital in the area. That's Emory University in Atlanta. And they performed a number of surgeries to try to determine how extensive it was, and it was very widespread. And they immediately began treatments as soon as I recovered from the surgery. So from the time that we discovered it to the time that I started undergoing treatment was just 2 or 3 weeks. It was very short and began immediately. Well, you can see it's been nearly 30 years. I am healthy, and after enduring 6 months of radiation, I went to the doctor every year for the next 5 years. After 5 years, they claimed me as being in remission, and now I go just periodically to test and make sure that there's no recurrences or if it's transformed into any other kinds. And so I'm just as healthy as the next person is, and just as unlikely to get Hodgkin's or any other type of lymphoma as anyone else is. Sure. I don't think that you go through this type of experience without it changing you. In fact, my wife, your mother, Emily, we were dating at the time, and it was through this experience that we were sure that we were meant for each other. She stood by me during the whole thing, and our relationship got very strong, and as a result, you're here. Well, I think first of all, you've got to make sure that you find a good balance between what you do in your work life and what you do in your home life. Make sure that somebody once told me that your life is like a jar and you can only put so many things in the jar. Make sure you put the big things in first. The big things are things like exercise, eating right, getting enough sleep, spending time with your family, making sure that you support the spiritual aspects of your life, and then cram all the other little things that are left over into the space that remains, and then you've got a balance to your life. And I try to do that. I get up and I run nearly every day, and try to make sure I spend enough time with you and with Mom and with Ryan, and make sure that I don't let work just overwhelm me, because it sure could.
To conclude, Hodgkin's, as well as many other cancers, can be a very slow and miserable disease that may sometimes lead to death. However, in lucky cases like my father's, big things like this can change your life for the better. There are some ways you can help prevent diseases like Hodgkin's from happening to you. Wash your hands constantly and be alert of any infections that may be dangerously infectious. Put on as much sunscreen as possible. Stay active by exercising and keeping up with your shape. Eat healthy. Visit your doctor 1 to 3 times a year for checkups. If you find a deformedly shaped mole, mark, or deformity from underneath the skin, contact your doctor right away. If you aren't sure on how to check yourself, please visit the National Cancer Society's website at www.cancer.org to ensure you are taking the correct procedures and precautions.